Good morning. Today we have another meeting in series The Plastic Surgery over Coffee. The clinic hosts two outstanding plastic surgeons from Italy, precisely from Rome, Professor Fabio Santanelli di Pompeo and Professor Michail Sorotos. The topic of the meeting is BIA-ALCL, so it's breast implant associated anaplastic large cell lymphoma in breast surgery in women after breast augmentation and reconstruction. The first breast implants were used in 1963 thanks to doctors Chronik and Gerl. A lot has changed since then, especially more and more women around the world undergo breast augmentation and reconstruction surgeries. Currently, it is believed that there are approximately 40 million women in the world who have implants. The first case of BIA-ALCL was identified in 1997, but it wasn't until 2011 that the disease was discovered thanks to FDA research. And finally, in 2016, the World Health Organization classified the disease as breast implant-associated lymphoma. Here I will ask you, can you explain the problem to us? What exactly is BIA-ALCL?
BIA-ALCL is a lymphoma that happens around the capsule, which is around breast implant. This kind of lymphoma is breast implant associated, so it's different from other systemic lymphoma. The trigger is the breast implant itself. But what is important to understand is it's only texture implant that may cause this lymphoma, as there is no case of patient that has been exposed only to smooth implant and then they've got the lymphoma themselves. So smooth implants are totally safe.
Do you think the BIA-ALCL is the same as breast cancer? How to classify this disease?
No, breast cancer is totally different from BIA-ALCL. They take origin from two different tissues. Breast cancer origin from breast glands and BIA-ALCL origin from the lymphatic cells in the capsule around the implant due to the chronic inflammation. In 2016, it was classified by the World Health Organization as a specific type of the third type of lymphoma, which is purely associated to texture breast implant.
What does the research and data show? Does BIA-ALCL have any connection with the type of implants?
So, thank you for your question. Research has shown to us that there is no difference between the type of implant when it comes to shape. There is no difference with the type of implant when it comes to the filling of the implant, silicone or saline. But what we know for sure, and this is what was said by the European Commission and by studies that were done afterwards, is that only implants with a surface that is textured are associated with BIA-ALCL. And what is even more important to understand is that all textured implants behave the same and affect the incidence of BIA-ALCL.
Are there any documented genetic predispositions associated with the lymphoma?
So, from studies that the group of Sapienza from Rome did recently, we know that patients with BRCA mutation and TP53 mutations have a shorter event-free time. It means that the BIA-ALCL will occur to them earlier compared to patients without any genetic mutation.
Do you think there are any risk factors for lymphoma which can be identified in women with implants? Is in such a situation there are any possibilities to avoid this disease or prevention?
Yes, we recently done a study with a high level of evidence, which will be published soon, and we could identify different risk factors and protective factors. So the main risk factor we could identify is linked to the weight of the patient, so the body mass index. The higher is the body mass index, and the higher is the volume of the texture implant you have, the higher is the risk of having this disease. As a protective factor, we were able to confirm what it was already established by two different groups researching, that if you exchange the implant, if you replace the implant, or if you remove the implant, it has a risk-reducing role. So you can reduce the incidence and the occurrence and the risk of having this lymphoma if you replace your implant, and mainly if you replace a texture implant with a smooth one.
Do you think this disease, lymphoma, is very common or rare?
Okay, none of both. Because to say that a disease is rare, there it should have a risk of less than 1 in 2,000. And this disease is uncommon, because this is occurring in some casuistic even in one case every 300, as was established in New York by Peter Cordero or by Kolasinski. So depending on the casuistic, since we have an occurrence that is higher than 1 in 2,000, it's 1 in 300, we can define this disease as occurring uncommonly, but not rare. To define that the disease is rare, it's not so favorable, because it understates the importance of the disease and the risk itself.
What are the most common symptoms when a patient comes to us, and what cases should we think and suspect that we are dealing with lymphoma?
Okay, so the main symptom is seroma. Seroma means the accumulation of fluid around the implant inside the periprosthetic capsule. So most of the cases of BIA-ALCL present themselves with seroma. So I would like to say to the patients that if they have a swollen breast, they should go and visit their doctors in order to have themselves checked.
There are any tests which we can perform to be sure and diagnosed?
So when it comes to radiologic examination, we have to do ultrasound as a baseline test. And if we have liquid that we aspirate, we have to do two very important things. One is to send the liquid for biological culture to identify potential infection that is not related to BIA-ALCL. And the second is that we have to send the liquid to pathology, where they have to do the diagnosis of BIA-ALCL by characterizing and identifying the typical cells of BIA-ALCL, and with immunohistochemistry, which means that those cells are specific neoplastic tumor cells related to BIA-ALCL.
If we have diagnosis and we recommend treatment for these patients, what do you think? What's the best treatment for such patients with BIA-ALCL?
Okay, that's a very important question. We should say that this is very well standardized, but the most important is whenever a surgeon or a patient has the feeling that might be a BIA-ALCL, which means she may end up with the seroma. This kind of seroma usually start without any symptoms, sometimes during the night, and day after you wake up with the larger breast. Suddenly starts. So when you have a situation like that, before going to any surgery, first the doctor should aspirate the seroma and do the analysis, as Professor Sorotos said. That's extremely important, because once we go in the OR and we operate the patient, we should be aware if we are operating a suspect or a negative or a positive lymphoma. Once we know, the surgery is rather easy, because if you do an early diagnosis, then it's just like if you replace an implant and remove the whole capsule. So the treatment is implant removal with the whole capsule and the serum inside. So it should be done careful, total, intact capsulectomy together with all the potential neoplastic tissue. This is it. And it's possible to replace immediately the implant with a smooth one if the surgeon is confident that everything has been resected. So in the early stage, this is possible to be done. In later stage, when there is some extra capsular dissemination, then it's wise to wait and undergo therapy and then possibly replace the implant.
After this treatment, we can expect full recovery?
Yes, that is very mild, indolent disease, thanks God. Because first of all, we have a sign that immediately informs us that it might be. Other disease, you don't have this kind of alert. But with BIA-ALCL, you have the seroma. And the seroma inform you at the very early stage. So if you listen the alert and you do the early diagnosis, you can have a full recovery, which is about 95% of the cases. Limited number of cases may undergo to further treatment like chemotherapy, immunotherapy, or even bone marrow transplantation. And that's what we look forward to reduce as much as possible by informing patient and surgeon.
Unfortunately, despite many symposia and conferences devoted about this topic, this subject is still ignored by many doctors. I hope that today's interview with experts show us that lymphoma around implants is a serious disease, and we doctors and our patients should remember this. Thank you very much.